Welcome to this episode of the Neurokrish Immersion, titled The Interpretation of an Unexplained Malady. In this podcast, we are exploring why people have unexplained medical symptoms. Are mysterious illnesses purely products of imagination, or are the brain, nervous system, and the doctor-patient relationship deeply involved? Can neurological symptoms exist without structural damage? When 30% of patients are told all your tests are normal, while they continue to suffer debilitating symptoms, is there such a thing as normal healthcare anymore? And ultimately, can ancient wisdom help solve modern medical mysteries? Let's try and explore these thought-provoking questions together. What if I told you that right now in hospitals around the world, 3 out of every 10 patients are being told all your tests are normal, while they are suffering real debilitating symptoms that they feel are ruining their lives? The hidden reality of the patient: you know something's wrong with your body. Every test comes back normal. Doctors start seeming to feel frustrated or dismissive. You start questioning your own sanity. The universal experience: it's all in your head, but the pain seems to be real. Your test looks fine, but you continue to feel terrible. Try to reduce stress, but you know that stress didn't seem to cause all this. What we're trying to do is to delve into one of medicine's greatest mysteries: why your body can be screaming for help while every machine says you're fine. Normal tests don't necessarily mean normal health, and we're trying to decode that mystery today. I met Mrs. A some years ago. She was a woman who was hungry for answers, literally. She could eat a full meal and still feel that she was starving, and therefore she ate many times a day. Her bowels acted like they had a mind of their own. She was constantly exhausted, experiencing pain, and gaining weight. She happened to be the wife of a distinguished medical professional, and after dozens of tests, consultations, and many thousand rupees spent, they had no answers as to why this was happening. Now, does this sound familiar to you? An uncontrolled appetite. I eat, but I never feel satisfied. Be aware, the opposite can happen to some people. The appetite really drops for no reason at all. Irritable bowel syndromes like bowels. My stomach controls my social life. I'm all the time looking for a bathroom. Or indeed, the opposite. Sometimes constipation can be what people feel. Fatigue, aches, weight gain. I feel like I'm 20 years older than I am. Endless tests, all turning out to be normal. Every scopy, every scan later, I'm told that I'm perfectly healthy. There's nothing wrong with you. Now, this takes an emotional toll on people. You start having doubts. Am I making this up? You start feeling isolated. No one understands what I'm going through. People start getting depressed. I'll never get better if doctors can't find what's wrong. And indeed, after a period of time, people start getting desperate. I'll try anything to get better. And anything can include spiritual and other tantric rituals that one engages in the hope of getting better. So Mrs. A's question, and it could be yours: if I'm not crazy, I'm not making this up, why can't anyone help me? Now, if unexplained symptoms were a country, it would probably be the 8th most populous nation on earth. That's how many people are struggling with symptoms that medicine can't explain. I already told you that 1 in 3 of all hospital patients have unexplained symptoms. That's 1 in 3 people seeking medical help. That's millions of emergency room visits and, with responses that, oh, we can't find anything wrong with you. That's billions in healthcare costs with no particular solution. But of course, you're not trying to be the difficult patient. You certainly are not the only one who's going through all this. You certainly have never been crazy or attention-seeking in your life. And yet, you're part of one of medicine's biggest challenges. What this could imply? It could imply that the medical system is failing 1/3 of all patients. It could also imply that the medical professional is as frustrated as you feel for not being able to find an answer to your symptoms. It also means we perhaps need to think about healthcare a little differently, and the answer may lie not in having more tests, but in a better understanding as to why you're having these symptoms. The common patient experience is therefore the cynicism trap. You end up feeling labeled as neurotic, hysterical, or drug-seeking. Indeed, even close family members and loved ones start questioning, why are you having these symptoms if they can't find anything wrong with you? You start feeling dismissed. It's just stress. Lose weight. Try medication. You even can start feeling blamed. You're not trying hard enough to get better. And often that's something that family members come back with after they get frustrated with multiple hospital visits and many tests being done. On the other hand, the doctor who's looking at you feels helpless. I don't know what's wrong with you. I've looked for it high and low, and you know that. The doctor starts feeling very pressured. Most doctors work with 15-20 minutes time per patient, and they're not able to solve your unique problems. And then, of course, we all get defensive. We think that if the tests are normal, you must be fine. There must be some other reason for this, and usually what that is thought to be is psychological. And while that is not wrong, and quite honestly, psychological symptoms, as Freud has taught us, can manifest with physical symptoms, it's very important to ensure that you understand the reason why you have those physical symptoms, which may originate from your psychological distress. So there is a vicious cycle that the patient can end up becoming part of. The patient starts feeling unheard. The medical professional starts getting defensive. The patient starts feeling frustrated. This leads to medical professionals becoming dismissive. Trust can erode and healing stops. And then, of course, when you stop believing in your own judgment, when you stop trusting the healthcare system, you then stop visiting the healthcare system because you don't believe that the doctors or the professionals there can diagnose what you're suffering each day with. And when patients and doctors stop trusting each other, everyone knows this is at the cost of your health. Now, this frustration is not new. There was a very famous study at the National Hospital for Neurology and Neurosurgery, Queen Square, where I trained subsequently. In the 1980s, doctors were found to, and these were very eminent and senior neurologists, the best in the world, were misdiagnosing about 50% of patients as hysterical. And how did they find this? This was a study conducted by Elliot Slater, a famous neurologist, who went back from the records on all those people diagnosed to have this hysteria by the doctors. He went back and looked at what happened to them over 10 years. And that's where this 50% not really being hysterical and the symptoms that were labeled as possibly hysteria, and please remember, this was many years ago, those symptoms were discovered to have other organic bodily causes. And therefore, Slater's paper became a warning that one should be extremely cautious in dismissing symptoms as coming from hysteria. Professor Maria Ron, in the 1990s, I had the fortune of training with her, looked back similarly at the records, and she looked at all those people who were coming to the hospital. By that time, the term hysteria had gone out of fashion, and the terms that were being used most likely were somatoform or psychosomatic. And she and her team went back and looked at all those people with those diagnoses and what happened to them over 10 years. She found that 10% of patients were still misdiagnosed. And please remember, in this era, by the 1990s, medical investigation had really advanced. The hospital had some of the best scans in the world, the best tests in the world. Despite that, in 10% of cases, those thought to be somatoform or psychosomatic ended up having an organic, a physical cause for their symptoms. And advanced technology didn't necessarily eliminate the problem. And indeed, both these studies are a lesson in humility for all of us. It's therefore important to remember that what is unexplained today could be what is obvious tomorrow. And medical knowledge has its limits. Your symptoms are real. It may just be that we are not able to measure them just yet. Now, here are some reasons why you may have unexplained symptoms that nobody is able to find a cause for. The first and the most important one is that you have some physical process, an organic illness, something going on inside you causing these symptoms. It's there, we just can't see it in all the tests that we are doing. And this happens with early stage diseases. This happens with rare conditions. It happens when the technology cannot match clinical practice. One of the most important examples of this are autoimmune conditions manifesting as a psychosis. And this is something that we are increasingly encountering in my specialty of neuropsychiatry. Now, the second reason why you may have unexplained symptoms lies in the whole area of hysteria and somatization. It's your mind that is creating real physical symptoms. I take you back to Sigmund Freud. And what Sigmund Freud said is that when you have a psychological conflict that is so disturbing, you tend to repress those emotions. And when you repress those emotions over a period of time, they start to manifest as physical symptoms. And this is what Freud called conversion. So it's psychological distress manifesting physically. And one of the examples is when someone gets so traumatized by a psychological event, they cannot speak, and that not being able to speak goes on for a period of time. The third possibility is what we call health-related anxiety, or what can manifest as abnormal illness behavior. There is fear of a particular illness, and that is leading to illness-like symptoms. Worry cycles start becoming physical symptoms, and the person is worrying so much about their health condition that it amplifies their health-seeking behavior. The fourth, very interesting category for the medical profession, not very common. It used to be difficult to diagnose in the old days, but it had some very unique characteristics. It's called Munchausen syndrome. And to understand Munchausen syndrome, you need to read about Baron von Munchausen, who was a fictitious character about whom much is written. This is an unconscious need for medical attention. There is a complex psychological process where the person feels most comfortable being in the role of a patient. And it often reveals itself that when you look into the patient's handbag, there are multiple hospital slips. Or indeed, in the old days, when we did not have imaging, people would turn up in hospital with multiple abdominal scars, and they would come with what was called open look laparotomies being done. Somebody opened your abdomen, look into your abdomen to see what was going on. And of course, they would find nothing wrong. So they would close up. And then this would happen again and again because you went to different hospitals with the same symptoms. Such people tend to be addicted to the hospital environment and to their role as a patient. And the fifth is the very obvious malingering, where there is a conscious symptom exaggeration in order to have some material gain. I've had patients, for example, come to me and say that, oh, you must certify me as so unwell that I can't possibly go to court or I can't possibly appear in front of a tribunal. And there, what they're trying to say is that I have a physical symptom, or they pretend as if they have a physical symptom so that they can actually avoid a particular problem that they are facing. It's rare, but it's important to rule out. We have today the category of functional neurological disorder. Now, this seems to be all-encompassing, and it seems to bring together all the different possibilities that I was discussing a moment earlier. Some of us who've been in the profession a long time do think that this might just be old wine in an all-new bottle, an all-new encompassing bottle. But of course, the importance of FND today is that it has been validated by the World Health Organization as a diagnostic category, giving recognition, therefore, for people with unexplained neurological symptoms. And I think that that's a very, very important step forward. Now, let's try and understand FND. Imagine your brain is like a computer. The hardware, the structure is perfect, but the software, the function, has a serious glitch. That's FND, real neurological symptoms with no structural damage. And that's why when you do a hardware check like an MRI scan, the scans are normal, the structure is intact. However, there is a software problem. Networks are misfiring and functions are disrupted. Real symptoms, therefore, can emerge from such network problems. Weakness, my arm just won't move. Seizures, I am having episodes but my EEG is normal. Tremors, I can't control the shaking but people can't find a cause. Speech loss, I know what I want to say but I can't say it. Sensory changes, I can't feel my leg. The network is breaking down when the movement networks misfire, when the emotional circuits interfere with motor control, when attention systems can't filter properly. Now, FND is more common than serious neurological conditions like multiple sclerosis, but most people haven't heard of it, and that's why change is important in terms of awareness and thinking about it. It's 5 to 10% of all neurological patients, 2 to 5 per 100,000 new cases yearly, and as I mentioned to you, it's become a diagnostic category in the World Health Organization's International Classification of Diseases, the 11th edition, ICD-11. What this means for the patient, what does it mean for you if you have such symptoms? You're not rare. Thousands have shared your experience. It's now officially recognized. Neurologists are seeing this regularly. You're not just some weird case, and research is advancing, and this leads to treatments improving. So the recognition revolution has moved from hysteria to functional disorder, from dismissal to a diagnosis, from hopelessness to treatment protocols. Now let me bring you to the autonomic dimension. We have a part of our nervous system which functions autonomously, automatically, without our conscious control, and it's called our autonomic nervous system. It consists of a sympathetic and a parasympathetic component, and of course you can look this up to understand it better. When your autonomic nervous system goes wrong, you have fatigue. I'm tired even after sleeping 12 hours. You have palpitations. My heart is racing, doing nothing. You have gut health symptoms. My gut seems to have a mind of its own, either irritable bowels or constipation or worse. You can experience sweating or dizziness. I feel faint standing up. And many functional neurological disorder patients do have autonomic dysfunction too. The key player in the autonomic nervous system is your vagus nerve, which is your master regulator. It controls the heart, gut, breathing, and mood. And when it malfunctions, multiple body systems go haywire. The good news is that it can be treated and retrained. So The aha moment you might just be having is that your unrelated symptoms may all trace back to one misbehaving nerve. Fix the vagus nerve, you might well end up fixing multiple symptoms all at once. It's not magic, it's neuroscience. And of course, in a future broadcast, I will explore the vagus nerve in far greater detail. Now, one thing that has brought FND and the vagus nerve to neurological consciousness is long COVID. Now, have you ever wondered why COVID-19 can cause breathlessness, gut problems, fatigue, and rapid heart rate all at once? The virus found your vagus nerve and made itself a home. So, what we've learned from COVID is that the SARS-CoV-2 RNA found its home in the vagus nerve tissue. Inflammation damages nerve function, and the result is widespread autonomic dysfunction, which presents with all these things that I talked to you about: breathlessness, gut problems, fatigue, tachycardia. And one of the ways in which we diagnose it is really so simple. We do lying and standing blood pressure and pulse measurements in people. And if your pulse varies by more than 30 beats when you go from lying to standing, or indeed if your heart rate, your blood pressure varies by 20 beats of systolic or 10 beats of diastolic, then you have either postural orthostatic tachycardia syndrome with orthostatic hypotension, or indeed just one of the two on their own. So long COVID isn't mysterious. It's vagus nerve inflammation, multiple symptoms having one underlying cause, and treating the nerve can improve all symptoms. So what if you could reboot your nervous system like restarting a frozen computer? Non-invasive vagus nerve stimulation is literally becoming the Control-Alt-Delete for your autonomic dysfunction. Now, how does it work? Gentle electrical impulses delivered through your ear electrode. It's an outpatient procedure. There is no surgery. There is no hospital stay. It's evidence-based, FDA-approved technology. It's safe and well tolerated with minimal side effects. What does it do? It restores your autonomic balance. It calms overactive responses. It reduces inflammation. It breaks the inflammatory cycle. It improves heart rate variability, better stress resilience, and indeed heart rate variability is a cardinal symptom of autonomic dysfunction. And it enhances mood regulation, a natural antidepressant effect. Each treatment lasts 20 to 30 minutes. All you feel is a gentle buzzing in your ear. Improvement happens in weeks. Most people need 2 to 3 months of treatments, and it can be combined with a range of other therapies. Now, when many healing traditions come together to work for you, you end up having what we call comprehensive care. And this is what we offer at Buddhi Clinic. We start with modern medicine, a proper diagnosis and medical management. And here, we insist on examining in detail the autonomic nervous system, which is actually a painstaking process. This advanced neurological assessment helps us decide whether the person really has dysautonomia and whether the dysautonomia can be treated. How do we work? We have the vagus nerve stimulation, of course. We have other types of brain stimulation that help with anxiety and depression. We have psychology, cognitive behavior therapy, stress management techniques, and trauma-informed care. We work with nutrition, anti-inflammatory diets, gut-brain axis optimization, personalized meal planning. And of course, we have a full house of yoga, Ayurveda, and naturopathy leading to nervous system regulation through movement, constitutional assessment and treatment, and mind-body integration practices. Now, what we've put together is a holistic paradigm, which is comprehensive, patient-centered, and leads to resolution of symptoms. Now, remember Mrs. A, the woman with an uncontrolled appetite and endless normal tests? Now, here's how she went from medical mystery to complete recovery in 8 weeks. Her autonomic dysregulation was diagnosed by us. We understand that she had abnormal illness behavior and health-related anxiety resulting in health-seeking behaviors. But while she did not have an organic disease that a scan could diagnose, she had many treatable conditions. So she was given medication to stabilize her autonomic nervous function. She had CBT to address health-related anxiety. She had nutritional interventions. She had vagus nerve stimulation. She was given yoga, Ayurveda, and naturopathy with stress reduction and constitutional support. Weeks later, her appetite had normalized. I eat normal portions and feel satisfied. Her bowels were regulated. I can eat out without panic. And her energy was restored. I feel like myself again. And in her own words, for the first time in years, doctors listened and had a plan that actually worked. So, integrative medicine really is a toolkit, and it involves bringing together many of these modalities of healing to help an individual. And of course, if this whole area interests you, I invite you to go and listen to the podcast, most recently released by us, The Promise of Integrative Medicine. Integrative medicine, as we conceptualize it in Buddhi Clinic, includes modern brain stimulation procedures, includes the use of modern medicine, but it also incorporates naturopathy and yoga, Ayurveda, acupuncture, acupressure, reflexology, psychology and counseling, and a range of other procedures like Tai Chi and mindfulness that can be part of a healing journey and help people get better. Now, when we think about all this, when we think about Mrs. A, when we think about people with unexplained medical symptoms who don't seem to have anything wrong in tests, I reflect on Hans Berger, who in 1929 invented the EEG and could record brain waves for the first time. His wisdom, and even then he knew the machine could not answer all questions. He famously said, "A machine can replace neither common sense nor intelligence." And I think the common sense and intelligence, and indeed experience of medical practice, where we spend time with people to understand not just what symptoms they have, or indeed look conventionally at why they have symptoms through scans and tests, but go further, go deep down to understand what exactly is going wrong constitutionally with the individual. Let's remember, technology has its limits. Not everything that matters can be measured. Human intelligence is really important. Medicine, as we practice it, is about pattern recognition, intuition, and experience. Common sense has to guide us. Simple explanations are often correct. And what is most important is the doctor-patient relationship. When we spend time with each other, we begin to understand what exactly is going on. And here, because modern medicine doctors like myself have limited time, multidisciplinary teams, as we practice in Buddhi Clinic, is really important in the practice of such medicine. Your healthcare reality, therefore, is that the scans do not show your suffering, blood tests don't measure your hope, machines don't provide comfort always, and humans are really important as a part of healthcare. And humans with experience, humans willing to spend time and listen, are really the backbone of good healthcare. Integrating wisdom, therefore, using the best technology available, applying clinical intelligence and experience to it, honoring the healing relationship in the way that we interact with our patients, and trusting common sense and compassion. These are, well, the most important touch points of the framework of healthcare. I'd like to give hope for the unexplained. The unexplained is real. The symptoms you're experiencing are valid. Your suffering is acknowledged, and your experience matters. Science is today catching up. We have a new understanding of functional disorders. I talked to you about FND, or functional neurological disorders, in this podcast. We have these advanced treatments like non-invasive vagus nerve stimulation that can provide hope and relief to many patients. We have a growing understanding of mind-body relationships and connections. Integrative care offers multiple pathways to healing. It's a comprehensive approach, and it focuses really on your functioning and your quality of life. Please be aware that you're not alone in this journey any longer. Effective treatments are available, and hope is not just possible, it's realistic. And on that optimistic note, I come to the end of this Neurokrish Immersion. If you liked this podcast, please subscribe and share with people you know. We are on Apple, YouTube, and Spotify. Thank you so much.